to do a supine to a lithotomy position. And when you do a supine to lithotomy, you want to start out with the head of the bed placed at the foot. So you have the foot section and a headpiece. And if you look at the mattress has a little cutout here. This is the way you would want it, because this is where you're going to want the patient's buttock sitting right over this cutout piece on the bed. All right. We're going to use candy cane stirrups today, and to put candy cane stirrups on, you want to have 2 Clark sockets. The other thing I want to make mention of is all the ORs have different kinds of beds. This one happens to be an AMSCO bed, but you could go anywhere and you could find different beds. The one thing about this bed, and I've told you all this before, is maybe you want to come over here, Kristen, and try to get a picture of this. When you look at this 3080 AMSCO bed, you will see the frame like this. So when you're putting a patient in lithotomy, their head has to be with the frame here. You cannot have the frame down here because you need to lower the foot section 90 degrees, and it will not be able to do that. So always make sure that the head of the bed now is here and the foot that way. Okay, so what we're going to do today is we're going to butt up the stretcher to the bed, and you can see that we're going to have to adjust this because she's way too high. Did you unmark it? Okay. And we're kind of, oh, no, a little bit more, maybe about there. Okay. All right. And our patient today has an IV. So we're going to have to take our IV and make sure that that comes with us and we can put it over here. And so we'll ask our patient if she can move onto this bed. And if she can, you know, that makes our life pretty easy. If she can't, then we'd have to use a roller board or slider board or the bag or something like that. And so we're going to put Sylvie's hair in her hat. And we're going to say that Sylvie can come over. And so then we would like to have somebody on that side of the bed and somebody over here. And I'd say, Sylvie, do you think you can move over to this bed on your own? Mm-hmm. Okay, come on over. And you always lean up against, we're always squeezing these beds together so that they don't come apart or anything. All right, good. Now, Sylvie, what I want is, I want you to feel the sides of the bed and I want you to center yourself. How do you feel? Pretty centered? Yep. And now if you feel down here, there's going to be a hole in the bed. Mm-hmm. Can you feel? Get just above that hole, if you will.
Above it?
Yep, just a little bit above it.
My butt's not in it?
Nope, we don't want your butt in it. A little
Okay.
bit higher. Okay, good. Perfect. All right. So that looks pretty good. So now what we're going to do is, I'm going to say, Sylvie, are your legs okay to be down like this? Okay. Now we can move the stretcher out. Somebody needs to stay with the patient and put a safety strap on. Or if you're alone, put a blanket on her, put a safety strap on, and then you can bring the stretcher out. Because anesthesia will always be here. So do we have a blanket? We can use a sheet. All right. So, because what's going to happen now is anesthesia is going to give Sylvie maybe a spinal anesthetic, or they might be putting her to sleep. So we have to keep her covered and keep her warm until we do that. Now we need a safety strap. And where did our safety strap go? Right here. Okay. So we would put the safety strap on her, and we could put 2 arm boards on now, and then we're going to have our anesthesiologist come down, and our anesthesiologist and our anesthetist are going to put our patient to sleep. So they're going to put the blood pressure cuff on, and the EKG pads, and the oxygen saturation, and then they're going to be giving the meds through the IV, and then they will be putting an endotracheal tube down so they can breathe for her. And so now we're going to pretend that that happened, and then now Sylvie's asleep. So what I like to do in a lithotomy position is I like to have arm boards on. You can tuck the patient's arms at their side, but you run the risks of pinching the fingers when you put the foot of the bed down or whatever. So I think it's just always best to have their arms out on arm boards. Easier said than done. These are hard to do. You have to really monkey.
Okay. That's good.
Yeah, we'll get it. All right. Now, make sure that this is angled a little bit. Push that lever out. And now we can put our patient's arms out on the arm board. Now here's the thing about lithotomy. When you put the patient's arms out, and you always want to secure them, but you may want to wait until you get them up in the lithotomy position, because here's what happens. Even though when Sylvie got on the bed and we got her to put her buttocks over that hole, sometimes they slip back, and so when you go to put their legs in stirrups, you need to have them right over that part of the bed, and so you might have to pull her down, and then if you've already secured your arms, you have to go through the trouble of unsecuring them and moving the arm boards and everything. And so sometimes it's just better if you just wait for until you get them in the lithotomy position. And so now what we're going to do is we're going to get our Clark sockets, and one is going to be put on each side of the bed, and it has to go on the back section of the bed. It cannot go on the foot section of the bed. So find the two notches in the bed and slide it. No, you got it on the back section. It has to go up here.
Oh, that is the back section. Okay.
And you can move this out. Right, and slide it about down to this joint. Okay. Now what we're going to do is we're going to take our candy cane stirrups. Thanks. And the candy cane stirrup is going to go in so that the bar is facing me like this. So slide it in.
I gotta move this out a little bit.
Yeah. And just tighten it then. Now we want to start out with them both at about equal heights. What do you think? Tight, equal height?
Yeah.
Okay. Now what I like to do is I like to take the patient's blanket now, and I just turn it and I put it over their upper half of their body. And make sure that their shoulders are in alignment with the arm board. Their arms aren't hyperextended. We don't want them up or anything. And now what we're going to do is we had to, of course, remove our safety strap, and we're going to put our patient's legs up in stirrups. We never do it unless we okay it with anesthesia first. And so we would say Nicole will be our anesthetist. Our patient is asleep, remember, and we'd say, Nicole, is it okay if we put our patient's legs up now?
Yep, it's okay.
Okay. Now, you could stand on this side if you didn't have arm boards, or you can stand down here, but you should both be in the same spot. So what we're going to do is turn so your back is to her head, reach underneath her leg, grab her by the ankle, and her leg's going to bend, and this is kind of hard to do. You have to reach back and grab the stirrup, and one goes underneath the ankle, and one goes underneath the foot. Now, you know our patient would not have shoes on, but that's okay. Yeah, pull, just pull.
Okay.
Okay, good. All right. Now, here's what happens. Sometimes, you never know if a patient's leg is longer from their knee, their femur, to their hip, or from here to here. And sometimes their leg will just go straight out. And then you may need to adjust this by pushing this way, or maybe you'll find that you have to raise it, or whatever. Okay, now our patient can't tell us how she feels. So you have to really look to make sure that you have some pretty good alignment, and something doesn't look right to me. There. Doesn't that look like, so just kind of stand back and make sure it looks okay. Now I usually just take the sheet, fold it up, and what you're going to do then is take the head piece that you put at the foot off, and you can go and put that then corner, and then you're gonna take the leg section off. And remember, some of the beds have the hard plates too, besides just this. So make sure you take it off before anesthesia lowers the bed, because if you don't, it's gonna come crashing to the floor. And then we're gonna ask anesthesia if it's okay to lower the bed. Now, if your patient's arms weren't on arm boards, this could be a problem. So you would want to make sure that her fingers were not caught in the hinge. But because they're out, we're really safe. So we're gonna say leg down. So anesthesia, can you put the leg down? Here's another thing that happens. Kick buckets. Somehow they end up and they get underneath here, and you wonder why the bed won't go down, because the kick bucket got stuck. And so I'll tell you when it's okay. That looks good. Okay, now, as you can see, she would probably need to come down even a little bit. And now if we had our arms secured, that would be a problem. So what we usually do is just kind of reach underneath their hips, and anesthesia would take their shoulders and help pull her down a little bit, okay? And then you gotta go back and you have to look at the arm board. Now look at this. This is not good. So what we want to do is bring this arm board, and you just bend that lever underneath here and pull it down just a little bit. And that's better then. And then we would put a warm blanket on her, of course, and then it would be time to prep the patient. Okay, surgery's over. We're going to do the reverse. So what we're going to do is we're going to say to anesthesia, can you put the foot of the bed up for us, please? And then we're going to put our mattress and our hard plate on our bed. We're going to put our head section back on the foot part so we extend. It's good. No, you gotta come down a little bit. That's good. Okay. Now, we always take the legs down together at the same time, slowly. We go in with the knees and then down over about 1.5 minutes to 2. So we won't take that long today, but we're going to put our hands underneath her calf. We're going to have to remove the straps, okay? And we would have asked anesthesia if it's okay. Now we're going to go in with her knees, and then we would slowly lower her legs. Okay, then we can go and get her a blanket. And we have to remove the stirrups and the sockets, and make sure now, because she didn't have a safety strap on, because of this position, we had her secured in the stirrups with this, that you don't leave her side. You would want to put a safety strap on her now when you went out to get the stretcher. And then it would be a supine to supine move. You did super.